Good morning and welcome to the virtual launch event for the Rapid Access Addiction Medicine Clinic at the Consumption and Treatment Services site in Kitchener. Thank you to members of council and our community partners and media partners who are joining us today. And thank you to members of community who are watching on YouTube. Today we are celebrating an important milestone for the CTS. The Rapid Access Addiction Medicine Clinic will provide integrated wraparound supports for people who use substances. We have a number of invited speakers with us today to provide more information about this clinic, and I will pass it over to Grace Birmingham, Public Health Manager of Harm Reduction.
Hi, and good morning, everybody. I'm just going to bring up the presentation. I'm going to try to make sure that okay, hopefully that's coming across clearly for everyone. Can I just get a confirmation of that, Carrie? Perfect, thank you. Okay, so thank you for your patience and good morning, everyone. I'm so pleased to be part of this event to celebrate the partnership between Sanguen Health Centre, House of Friendship, Stonehenge Therapeutic Community, and Region of Waterloo Public Health. To start off our event today, I'll provide some information about Consumption and Treatment Services site located at 150 Duke Street in Kitchener, and the impact the service continues to have in our community to support people at risk for overdose. Consumption and Treatment Services is one part of a comprehensive harm reduction strategy. Extensive evidence shows that CTS saves lives by reducing the number of fatal and non-fatal drug overdoses, reduces the spread of infectious diseases like HIV and hepatitis C amongst people who inject drugs, connects people who use drugs with primary healthcare services, addictions treatment, and social services like housing and other supports, and creates a safer community by reducing drug use in public spaces and providing options for proper needle disposal. At the CTS, people use their own drugs under the supervision of medically trained staff to prevent fatal overdoses. Under the provincial funding program, Consumption and Treatment Services site must provide additional wraparound services either on site or by referral that help address additional health needs of participants. Since the interim CTS site at 150 Duke Street opened in October of 2019, staff have provided various services, including prevention and reversal of overdoses, safer substance use education, wound care and first aid, harm reduction supply distribution, and safe sharps disposal. Throughout the pandemic, wraparound services, including primary care, mental health, housing, and other supports, have been available by referral mainly. With the opening of the permanent site in October 2020, the provision of on-site integrated services has been a priority. The integration of the Rapid Access Addiction Medicine Clinic represents an important milestone for the CTS site following a pause in our planning as community partners responded to the COVID-19 pandemic. Adding more on-site supports will occur as pandemic restrictions lift and as partner resources allow. Before we invite comments from others on the call today, I'd like to share some data about the site and how it has continued to support people in our community every day. Between March 2020 and March 2021, there were 5,721 visits to the CTS, averaging 440 visits per month. Staff observed a decrease in visits as the pandemic began to impact people in Waterloo region. Physical distancing requirements meant the CTS was able to see fewer people in a day, and the landscape of the downtown core changed with many closures, service relocation, and services moving online. By fall 2020, visits have been steadily increasing as CTS and its staff continue to make adjustments to ensure the safety of everyone visiting the site. While not portrayed here on the slide, there were 743 visits to the site in April, representing a return to pre-pandemic numbers. People consuming substances at the CTS are closely monitored by medical professionals to respond if an overdose occurs. Between March 1st, 2020 and March 31st, 2021, there were 201 overdoses reversed at the CTS by staff. I'd like to thank you all for joining our call today to learn more about this co-location of the Rapid Access Addiction Medicine Clinic and Consumption Treatment Services. Next, we will hear from Councillor Elizabeth Clark, who will speak to the connection of this partnership to the Maiden Waterloo Region vision for CTS. Afterwards, we'll hear from Dr. Ravi Abana, Associate Medical Officer of Health for Region of Waterloo Public Health. Next, Violet Eunuch, the Supervisor of the CTS in Kitchener, will tell us about the significance of this service for people accessing services at the CTS. And lastly, we'll hear from Tara Groves-Taylor, the Director of Addiction Services with House of Friendship, to speak more about the Rapid Access Addiction Medicine Clinic. So I'll now invite Councillor Elizabeth Clark to provide some comments.
Thank you, Grace. Well, as everybody knows, I'm Elizabeth Clark. I'm a councillor for the region of Waterloo. And I think most of you will know that I'm also a very strong and long supporter of CTS. So I'm excited that we're finally here today. It's taken a long time. Some will say too long, and that's nobody's fault. That's just a whole bunch of situations piling on each other. In my day job, I'm the CEO of the YW. And I think that experience is what's led me to believe so strongly in the work that the CTS is doing. We had an overdose death in our shelter this weekend. That was the second death we'd had in about a 2-month period. And so I know that those were 2 lives lost of dozens that we've seen. And those are deaths that could have been prevented. And the CTS has a significant part to play in preventing future deaths. CTS services are an important measure within the Waterloo Region Opioid Response Plan to address the opioid crisis affecting Waterloo Region. Well before the CTS opened at 150 Duke, community consultation occurred to develop a Made in Waterloo vision for this service model. It was important for the community to think about how these important services could be provided in a way that's innovative, supports the needs of people who use substances, and builds on ideas and addresses potential challenges raised to date. The CTS needed to be provided in a way that was specific to Waterloo Region, and a key element of this vision is accessible and appropriate services within an integrated service model in place. People who use substances will have barrier-free access to multiple services. Today, we're celebrating an important milestone in seeing this vision come to life with the integration of a rapid access addictions medicine clinic co-located in the CTS at 150 Duke. Thank you.
Thank you, Councillor Clark. We'll now hear remarks from Dr. Ravi Abana, Associate Medical Officer of Health for Public Health.
Thank you, Carrie. As Carrie mentioned, hi everyone. My name is Dr. Ravi Abana. I am an Associate Medical Officer of Health for the region of Waterloo. I'm also a practicing family physician with a focused practice in providing care to unhoused or precariously housed individuals. As an Associate Medical Officer of Health, I work with public health programs and services supporting the determinants of health and equity, including our harm reduction team. There are many factors that have an influence on our overall health and well-being, which we often refer to as the determinants of health. And these can include a broad range of personal, social, economic, and environmental factors that impact both individual and population health outcomes. Partnership is a cornerstone of public health's ability to address the determinants of health and deliver programs and services that meet the needs of the populations that we're working to support. The Consumption and Treatment Services site, which opened in October 2019, is operated by our partners at Sanguen Health Centre. Today, we're announcing another important partnership with House of Friendship and Stonehenge Therapeutic Community, with the opening of the Rapid Access Addiction Medicine Clinic located at the Consumption and Treatment Services site. The co-location of a specialized medical clinic designed for people who are experiencing health issues related to their substance use is an important milestone for the Consumption and Treatment Services site. This clinic is the first wraparound service to begin operation at the CTS and is operated by House of Friendship and Stonehenge. After a pause due to the COVID-19 pandemic, planning is resuming to support the on-site location of additional community partners to expand wraparound services offered at the consumption and treatment services site, including primary care. Treatment is a part of recovery and rehabilitation, which is one of the 4 essential pillars identified in the Waterloo Region Integrated Drug Strategy to address the harms associated with drug and substance use in our community. Treatment services are offered along a continuum of support for people who use substances based on individual needs and the goals of recovery. The goals of treatment include improving quality of life and individual health while addressing substance use. Public Health is very grateful for the work and support of our partners at the Consumption and Treatment Services site. They bring both their expertise in service delivery and care for our community to the work that they do. And we would like to express a huge thank you to our partners, Sanguen Health Center, House of Friendship, and Stonehenge Therapeutic Community. Thank you.
Thank you, Dr. Abana. I'd now like to invite Violet Eunuch from Sanguen Health Center.
Thank you so much. To say that the Consumption and Treatment Services staff are excited about this partnership and about the Rapid Access Addiction Medicine Clinic being on site would be a vast understatement. Sanguen Health Center recognizes harm reduction as a continuum, and the role of the CTS specifically is to provide services that meet the needs of each person who walks through our doors, recognizing that while they are there because they are a person who uses drugs, they are a unique individual with a unique history and a unique path forward in life. The entire CTS team is grateful to have the privilege of working and providing the best care possible for each person that we meet in any way that's requested and in any way that we are able. We believe that people are experts in themselves and that our role is not to push or to punish, but to provide barrier-free access to services and the support and the love and the encouragement that people need as they are making positive changes. The CTS team does incredible, literal, life-saving work every single day, and it is a beautiful thing to be a part of and to see in action. But our team ultimately does not believe that that's enough. It's not enough for our clients and it's not enough for our community. Our team believes that people deserve to stay alive, but also to thrive, to be connected, to be included, to have choices and to have options. And since the first day that the site began to operate, we've listened to clients describe their urgent needs and their hopeful wishes. From there, we've been working to identify partners who can meet those needs, who can fulfill some of those wishes. Agencies, groups, and individuals who are passionate about providing professional, respectful, flexible, thoughtful, kind, caring services to people who use drugs in Waterloo Region. And as Grace said earlier, like every other part of life over the past year, COVID has had a significant impact on the CTS's clients and on our staff, and it definitely impacted our ability to move forward with bringing services on site. So we're very thankful for the many people who are willing to find creative ways to continue the process. And these conversations are ongoing and they're really exciting. Which brings us to today, where we are delighted to partner and have the Rapid Access Addiction Medicine Clinic staff on site, recognizing that they have an incredible philosophy of caring. Their willingness to provide services on site at the CTS will reduce so many barriers, and meeting people where they are already comfortable goes so far in helping people take the first step in a process that can be intimidating at the best of times. We know that there is no one-size-fits-all solution to problematic substance use. And having the RAM Clinic ability to provide options and choices, meeting the needs of each unique individual, fits with what we've heard over and over from clients who have talked to our team about wanting to make changes to their substance use. Clients have told us that they want to feel safe to explore possibilities, to have the stigma of substance use understood, and to have the complexity of addiction be recognized. Our team is so grateful to be able to refer clients to a service that they have requested in a place that they've said they'd like it to be and in a way that will work for them. And this partnership will allow us to fulfill some of those urgent needs and some of those unique, hopeful wishes. And we are so excited. Thank you so much.
Thank you, Violet. And now I'd like to welcome Tara Groves Taylor from House of Friendship.
Thank you so much. I just want to start by saying thank you to everyone who took the time to join us today. I think, as you can tell, we're all very excited to be able to share this new beginning with you and this partnership with you. It's nice to be able to come together and talk about some good news for our community. I think it's also very timely that we're launching a partnership such as this when we know that certainly the impact, especially from the pandemic, has resulted in about roughly a 74% increase in addiction and mental health issues, as recently outlined by Addictions and Mental Health Ontario. We also know that we've seen a steady climb in our referrals, and then of course associated wait times. So it's great timing for something such as this. The Rapid Access Addiction Medicine Clinic is a service that's offered, as outlined by other speakers, through the partnership between ourselves at House of Friendship, Stonehenge Therapeutic Community, and the nurse practitioner-led clinic. RAM clinics have been operating across our region since 2017, and we're just so happy to be able to take this next step in partnership and in a hub model of services. It is a walk-in service that requires no appointment or referral, which makes access so much easier for the individuals that we serve. And the services are brief in nature and include medical addiction care along with counseling, as well as community referrals. As Violet and Grace both talked about, we've been in conversations about this happening for the better part of 18 months. Once we were able to reinvigorate those conversations, we were able to create a plan very quickly to move our RAM location to our RAM clinic to this location. COVID did certainly cause some delays, but we're just so happy to be going live with our services there as of next Wednesday. Today's launch of the RAM clinic and the CTS being located in Kitchener also represents a strengthening of our existing partnerships with the Inner City Health Alliance. Many of those partners already mentioned today, as well as with the region. It's a needed step in continuing to build a strong harm reduction continuum of services in our community. People experiencing addiction and substance abuse require options that provide the right services at the right time in a low barrier environment. I recently had the chance to hear a story about a young mother who has access to a variety of our services at House of Friendship. She'd struggled with alcohol abuse and dependence since she was 14 years old, a substance she described using in order to drown her feelings and emotions. When she was blacking out from her drinking and was also a young wife and mother, she realized that she needed to access services. She also came to this realization during COVID, which added to the difficulty, but was able to find virtual service offerings to help her start her journey. The Rapid Access Addiction Medical Clinic represented the medical component that she needed to help with the agonizing withdrawal symptoms that she was experiencing. And she's now happy to report that she's well into her journey of recovery. This fully represents the right service at the right time. And that's what these services and this partnership will do. It's stories of hope like this one that drive us to do this crucial work. Opportunities like the one that we're highlighting today allow us to continue to walk with those that we serve on their journey. And what a great privilege. Thank you.
Thank you, Tara. Once again, thank you to all our invited speakers this morning. We now have time for media questions about this clinic. Reminder, it's one question and one follow-up. And I will start with Catherine. Perfect. Go ahead, Catherine.
Hi, good morning. So I'm just wondering if you could sort of, I guess there's a couple of things I'm hazy on. So there's obviously RAM clinics elsewhere. I know there's one in Cambridge, and you referred in passing that there are others in the region. So I just wondered if you could clarify that with specifics about how many and where. And also I'm just looking for some kind of, if you could paint a picture for, what it looks like if someone walks in, what happens? What do they get? What kind of services? How are they, what are you guys actually going to be doing? But in sort of specific, tangible examples.
Great question. I think I'll probably defer to Madison to answer that question, if that's okay, Madison.
Yeah, absolutely. Happy to. Hi, Catherine. So yes, we do, in partnership between Stonehenge and House of Friendship, we do run a regional network of RAM clinics. So we do have 2 days a week offered in Cambridge, Kitchener, Guelph, and Fergus, and are in the process of expanding into rural Wellington further as well. So when somebody comes to any of our rapid access addiction medicine clinics, when they walk through the door, they're greeted really by a team of support. So we have an office assistant that would greet that client, as well as a peer support worker who has lived experience of their own substance use challenges. That peer support worker can sit with them, kind of walk them through that process, and really provide a lens of support and comfortability in being able to take this step that is really, really challenging and huge for a lot of people. Once they've been able to kind of meet with our peer support worker, they'll then meet with a counselor who is trained for addictions counseling specifically. They meet with that counselor to be able to do an intake process in tandem then with a nurse practitioner or medical doctor who has the addictions medicine specialty. Throughout that work with both the addictions counselor and the medical professional, they're able to establish a treatment plan that covers really the full biopsychosocial model of support. So they may have some pharmacological intervention, they may have some counseling focus, but really that's a team approach to determining what the best course of care is for that particular individual and their support.
Okay, thank you. Can I ask a follow-up as well?
Yes, go ahead, Catherine.
Great. So I'm just wondering how many people you figure, I mean, you gave figures about the number of people who are going to the CTS site, but how many people do you think will be using this specific clinic, and also funding, like what's the operating budget and who's paying for it?
So if we look at just the Cambridge and Kitchener clinics specifically within our region, we look at anywhere from, and of course we've been ramping up over recent years, but last year we would have served close to 500 unique individuals, and we finished off this current year serving even more than that in this region, which is quite remarkable given the COVID restrictions and pivoting to virtual services, as well as shutting down for a period of time. So as I said, you know, our referrals continue to grow, as do the service needs. Resourcing, we are funded through the Ministry of Health, through our local Health Integrated Network or Ontario Health Teams currently. That's where the funding comes from.
Thank you, Tara. And I also have Casey from 570. Do you have a question?
I was going to ask the first question that Catherine asked as well. So I think I'm good with that.
Okay. And Catherine, do you have any other questions?
No, I think I'm good.
Okay.
I hope I got a good grasp, but we'll find out, I guess, when I'm writing.
All right. And I did connect with Carmen. She isn't able to connect with microphone, so we might have some follow-up questions from her that I will connect with the group. So that concludes the virtual launch event. And I thank everyone who joined us today to celebrate the opening of the Rapid Access Addiction Medicine Clinic at the CTS. And I thank everyone for sharing. I think you know, it's a really important step, and it's a very exciting day for everyone involved to be able to see this service available at the Consumption Treatment Services site. So I thank you all for joining, and I wish you all a wonderful Wednesday. Thank you, everyone.
Thank you.